Good afternoon and welcome again to Endovascular TV. We are here now with Dr. Michael Dake. Dr. Michael Dake doesn't need any introduction because he's a well-known person in the vascular world, working with vascular therapy and supporting innovation since so many years. So this is quite important, and we are grateful to have him here today with us. Thank you for joining us.
It's my pleasure to be here.
I would like to ask you, this is a question that probably many people repeat to you since long time ago, but how do you see the future of the endovascular therapy?
Well, that is a question that comes up quite often, and certainly here at this Congress we're discussing a lot of the endovascular options, talking about what the future will bring, trying to understand the limitations and the challenges that face. I think I sort of divide it into sort of maybe near-term and long-term opportunities. I think for us, one of the future for endovascular in the near term involves really around combination therapies, really understanding what the role of drug-eluting stents, drug-coated balloons, and bioresorbable drug-eluting scaffolds will be by lesion location, femoral popliteal, tibial, and really trying to know really where these individual therapies may be the most relevant to help patients. Now, when we go out long term, I think it's just, then we're talking blue sky. What the future is, no one knows, but certainly it's going to involve, I think, endovascular is right now very popular. It doesn't mean that it discounts what surgery has done. In fact, surgery remains very relevant. But from invasive to less invasive to even minimally non-invasive therapies, maybe something in how we look at genomes, metabolites, stratifying patients for what their risk factors are, understanding if cell-based therapies may have a role in certain patients. And I think what it's really getting down to is that trying to get on the whole trend of personalized medicine, personalized vascular care based on your own risk factors, how we can modify them with drugs, lifestyle, smoking, etc., and then trying to pick out therapies which we know have the best chance of providing you a long-term sustainable benefit. So near term, we're still very device focused, trying to understand these new devices and really what role they will have. Long term, I think we're going to be heading to even more minimally invasive therapy and looking at the role of drugs and cell-based therapies.
So let's talk about the challenges, not the future, the current challenges for our therapy, for the vascular therapy today. Which is your opinion about that?
Well, there was a lot of talk about this morning in our sessions, and I think really the one thing on everyone's mind when we talk about challenges for endovascular therapies is really the cost and the economic. How do we really prove value? It's a challenge not only for us as physicians, but clearly for those individuals who are involved as device manufacturers, but also for hospitals. How do we really allocate the limited, precious resources we have economically to bring to bear on vascular disease in the most efficient and, I think, value-laden way, so that we're sure that when we're spending money of our society, money of individuals, that it's really buying something that's durable. So I think for the near future, as near as I can tell, the challenges will heavily be weighted towards economic and proof of value.
Okay, and in this line of thinking, which are the challenges for the congresses, for the events? Which situation do you imagine in the next future for this kind of events will be?
I think in Congress going in the future, we have to respond to the challenges we just talked about. So every session should, at least, not every talk, but at least session, should give some perspective on what the financial challenges are for these technologies, how we really understand the value we're bringing. And it's difficult for us to think who are physicians and don't have training in business. Likewise, it's very difficult for the sponsors, manufacturers, and the hospitals to really put together programs and really analysis that with software that can really give us data that so it can become a relevant part of discussions. Right now, we're just talking generalities about cost. We have to get down to specifics and really understand what the impact of having to do a repeat intervention is. We know it's very costly, but let's actually get some amount in terms of euros per
Yeah.
re-intervention. How this device or that device could either forestall or even cause not to have any re-interventions. And I think that's something that we really, as those who organize congresses and meetings, really need to take seriously, because in the future it's really going to impact what we're able to do and what innovation, as new technologies advance, how the economic realities will either allow us to go forward or will keep us stuck where we are now.
Yeah. So I also like to have your opinion in our Congress, because we are now here at the city meeting, and this is an effort, an organization, and everything. I would like to have your opinion. How do you feel about that?
Well, this is, I believe, my third city meeting. I remember how, and it's evolved. I think the last time I was here, we were at the Hilton.
Yeah.
Now we're at a much larger Congress Center. And the fact that this is the 10th anniversary certainly bears testimony that it's a success. The attendees certainly enjoy the experience. They're more here than ever. I think we're starting to get in, as we saw this morning, into some of these futuristic trends in terms of not only imaging, but interventions that are beyond simple device-driven, but we heard lots of things about more scientific, basic talks on how we're pushing the frontiers in terms of knowledge out, and I think that's what a leading Congress like CITE has to do. Some Congresses don't have that luxury, but the faculty here is very large, and the organizing committee has put together a very good program. It's very stimulating, highly educational.
Thank you very much. It was a real pleasure to have you here today. This is also an honor can perform this interview with you. And I hope you like this new approach that we are trying to do with endovascular.tv and support a little bit this.
Well, it was my pleasure.
In the future.
And
thank
it's
you
very exciting
much,
to be
Dr.
here.
Dake.
I hope the patients enjoy it. Thank you.
And thank you all for attending. We will be back with Endovascular TV.